Hello, I'm Dr. Pooja Gupta, Consultant Pathologist, Lifeline Laboratory. Today, we will be discussing briefly on cervical cancer and HPV infection, that is human papillomavirus infection. Cervical cancer is the second most common cancer in women in the world and in India. It comes next to the breast cancer. It is a major public health problem and a cause of morbidity and mortality around the world. Now, what causes cervical cancer? So, the causative agent is human papillomavirus, which is HPV infection. It is a sexually transmitted disease. Human papillomavirus is divided into two subgroups, low risk and high risk. So, this is the high risk group which causes cervical cancer. Now, the question comes how it is diagnosed. So, there are two ways of diagnosis. One, the patient experiences unwanted symptoms like postcoital bleeding, postmenopausal bleeding, pelvic pain during intercourse, and foul smelling discharge. The patient goes to the doctor, gets herself examined, and the doctor does certain tests like pap smear or biopsy. The tests are sent to a pathology lab and the doctors study the slide and look at the cells. At this stage, the cells are cancerous and the patient is labeled as cervical cancer patient. But this might be the time when the cancer has already spread to other parts of the body, and management at this stage causes morbidity and even mortality, that is death of the patient. The second way of diagnosis is screening. So what is screening? Screening means diagnosis at a stage when the symptoms and signs of a particular disease or cancer has not appeared in the person. So this is a routine time. Fortunately, in cervical cancer, this is possible. Screening causes very decreased morbidity and negligible mortality to the patient. So how do we do screening in cervical cancer? Pap smear and HPV detection. As I mentioned earlier, HPV, which is human papillomavirus, is the causative agent for cervical cancer. If these two tests are done initially prior to the appearance of symptoms and the cancer is detected at an early stage, this is the stage when the cancer has not appeared but it is a precancerous stage. There are certain abnormal cells or abnormal changes in the body which are detected. So detection at this stage causes decreased morbidity. These are very simple tests, outdoor procedure which takes very few minutes and doesn't cause much pain to the patient. So HPV detection and pap smear screening, these are recommended co-testing procedure by the American Cancer Society and by WHO also. So ACS, which is American Cancer Society, it recommends screening with pap smear and HPV for every woman with the cervix between the age of 25 to 60 years. So in this way, the cervical cancer can be prevented.